Okay, let's dive right into this. Welcome to The Explainer. Today we're exploring something absolutely fascinating: the rapid, pretty much unprecedented evolution of patient rehabilitation through technology. We're finally moving past the days of isolated clinic visits and having to rely entirely on your memory for home exercises. Instead, we're entering this incredible era where cutting-edge tech, continuous evidence-based practice, and highly patient-centered care are literally rewriting the whole recovery model.
So, imagine this. What if your physical therapist was always with you? It sounds a little crazy, but that single question perfectly frames the core limitation of traditional in-clinic rehab. In the past, your therapist only ever saw a tiny, isolated snapshot of how you move. But now, by replacing those historical blind spots with a continuous, data-driven connection, modern tech is fundamentally changing how the human body recovers from injury and illness.
For today's explainer, we'll be breaking this down into 4 key areas: the new physiotherapy revolution, wearable tech in rehab, robotics and exoskeletons, and finally, the tech-driven holistic future. Let's get started. Part 1, the new physiotherapy revolution, setting the digital stage. Before we get into the cool hardware, we really have to look at the invisible digital infrastructure powering it all.
And that brings us straight to digital health and artificial intelligence. Now, in modern physiotherapy, AI isn't just a buzzword, it serves a highly specific clinical purpose. Predictive algorithms are now capable of crunching massive amounts of your biomechanical data to map out highly personalized recovery timelines. It actively assists your therapist in creating individualized programs. Think of it like a supercomputer that builds a specific, adaptable roadmap for every single patient, keeping you consistently engaged and, more importantly, on track.
Once you have that digital foundation in place, you can deliver care pretty much anywhere through telerehabilitation. By utilizing remote physiotherapy services, patients are now getting high-level assessments, exercise supervision, and follow-up care right from their living room couches. And what's really fascinating here is just how quickly this is scaling. Telerehab platforms can often expand a therapist's functional reach tenfold. They're generating hundreds of new, actionable data points between physical visits, all while completely solving those traditional geographic and mobility barriers.
The modern clinic is seamlessly integrating some other wild digital modalities too. We're seeing virtual reality and augmented reality being deployed to create interactive environments that drastically boost your motivation during balance training and motor learning. Make it a game, right? Simultaneously, advancements in pain neuroscience education are teaching patients the actual neurophysiology of pain, which really improves coping strategies for chronic conditions. And tying the whole shebang together is enhanced outcome measurement, which basically uses objective digital tools to make purely data-driven clinical decisions.
Moving right along to Section 2, wearable tech in rehab. This is where things get really personal, and the patient actually becomes a continuous data source.
Look at your wrist right now. That smartwatch, it represents a massive leap forward. It's basically a real-time rehab tool. Everyday consumer wearables and motion sensors are now providing high-fidelity, real-time telemetry, actively bridging that clinical blind spot between your therapy sessions. This constant stream of data lets therapists observe exactly how a patient's body is responding to real-world stressors, entirely outside of that controlled, perfectly flat clinic environment.
Let's move to the next step and see how this builds, because the pipeline of this wearable data creates an absolutely perfect feedback loop. First, sensors constantly monitor raw movement patterns and gait parameters. Next, that data instantly tracks your real-time exercise compliance. No more fibbing about doing your stretches. Finally, this allows the therapist to continuously update a highly personalized treatment plan. The wearable tech ensures the rehab program is adapting to your actual real-world progress and physical mechanics minute by minute.
All right, Section 3, robotics and exoskeletons. This is where sci-fi literally becomes reality.
Now, what's really interesting about this slide is just the sheer, life-altering impact of this tech. Robotic exoskeletons demonstrate an incredible evolution in care. We have moved way beyond passive braces into the realm of advanced robotic-assisted devices that actively help patients move. These machines perfectly support body weight and provide carefully calibrated physical force. That allows patients to perform complex, repetitive movements that would otherwise be entirely impossible without the physical lifting and assistance of multiple therapists.
So who actually benefits from this? Well, for folks recovering from strokes, severe spinal cord injuries, or debilitating neurological disorders, these robotics-assisted use cases are absolutely transformative. By facilitating intense, precise, repetitive motor training in gait and upper limb rehabilitation, robotic exoskeletons are actually fundamentally rewiring the brain. This neuroplasticity is effectively restoring lost function and giving highly compromised patients a very real, viable path back to mobility.
Let's zoom out for a second. The contrast between standard care and this new era of precision rehabilitation is pretty profound. Where old standard care relied heavily on generic exercises and super limited tracking, precision rehabilitation, which is unlocked specifically by the wearables and robotics we've just been talking about, relies on exact patient data. By continuously analyzing your unique biomechanics, functional assessments, and lifestyle factors, therapy is now entirely optimized to your specific physical fingerprint.
Which brings us to our final section, the tech-driven holistic future. Because we have to ask, how does all this hardware integrate with the human biological element of healing?
Well, it turns out the future of physiotherapy is also deeply biological. Regenerative rehabilitation is this highly promising field that is seamlessly merging modern physical therapy with regenerative medicine. Think approaches like stem cell therapy and platelet-rich plasma, or PRP treatments. The core goal here is to enhance the body's tissue healing at a cellular level, while advanced physiotherapy steps in to ensure that the newly healed tissue achieves maximum functional recovery. It's a real game changer.
And this brilliantly illustrates that ultimately, rehabilitation is a multidisciplinary, collaborative effort. Despite all the incredible advances in robotics, AI, and continuous data tracking, recovery remains a deeply human endeavor. Physical therapists are working hand-in-hand with physicians to manage overall health, psychologists to navigate the heavy mental toll of recovery, occupational therapists for daily living strategies, and nutritionists to fuel that cellular repair we just talked about. It's a truly holistic approach addressing all aspects of human health. So to wrap things up, recent advances have dramatically shifted the entire landscape of physiotherapy. Thanks to technology integration, highly personalized wearable data, and advanced robotics, care is far more effective and accessible than it has ever been in human history. So, I'll leave you with this to think about. As this tech becomes more common, how will your own future health outcomes be shaped by the very devices you already interact with daily? It's a fascinating new era for human performance.